Okay, so I'm going to talk about day 2, the day after the surgery. Um, in the morning, the nurse woke me up. The nurse that um, came in at 7:30 p.m. and she was through the night shift and she was going to leave at 7:30 a.m. So I guess before she leaves, she's responsible for 4 patients. This is in the ICU, and she has to one by one get them washed up and out of bed and in a chair, and then go to the next one, and then go to the next one. So at 4:30, she's waking me up. Good morning, Stephanie. I'm going to give you your bath. We're going to go in the chair, and it was so hard to sleep, and so I was a little like, I wish I could rest. My body probably needs to rest because I was just, I don't know, but maybe she knew she needed to get me up in the chair. She had to clean me because you got to stay clean, whatever. So, but it just 4:30 in the morning, really? Can't like the nurse that comes on at 7:30 have that job? Um, so that's what this nurse every morning at 4:30, she was coming in my room. And then like my fourth day, I finally got up the nerve to say, "Can you do it at 6:30 instead?" And she's like, "Oh, sure, no problem." So I should have just asked to begin with. Um, I just figured I couldn't change her schedule. Um, so I took a walk around the unit for the first time with the physical therapist, going really slow. My blood pressure was very low. It was in the 80s over 50s. And they drew blood. First, they gave me medication to raise my blood pressure. And then um, I didn't know why it was low. I just thought that this happens after surgery. Um, Before my surgery, my cardiologist had me on Nadadol, which I think is a beta blocker, and he put me on to purposely slow down my pulse, and it also lowers blood pressure. So when I was on the Nadadol, my blood pressure was very low, like 90s over 60s. But they said the ER doctor, not ER, I don't know if I said ER before, the ICU physician, in the cardiac unit, um, he said he doesn't want to see anybody in the 80s, and he gave me medication to bring it up, and it went up to like 101 over 65, so it was much better. And if your blood pressure is too low, the oxygen isn't going to go around your body and get to where it needs to go for your organs. And also, what was happening because my blood pressure was so low was I had a very rapid heart rate because your heart's saying there's not enough blood getting moved around, so I need to beat faster. So my pulse at rest, did I write it down on that day? My pulse at rest was anywhere from like 95 to 111. Um, it ended up being that my hemoglobin was low. And I'll get to that in the next video because I didn't know that yet on day 2, and they didn't know that on day 2. I guess they didn't do a transfusion during the surgery, so I figured. Well, I'll talk about it in another video. Um, so the tubes, the breathing tube, the drainage tubes. Holy crap! It's the most painful thing about this when they're in, and they said that children and small framed people have the worst time with them because these tubes, they're like an inch. They're like an inch in diameter. And you got 3 of them. The holes, I'll show, I might show my scars in another video. I guess I could show the holes. The holes closed up, so they're not um, as big as they were. They're getting smaller. But here's the 3 drain tubes, like bing, 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 right in the middle. And so the tubes were up past that. Here's where they are. So the tubes were probably like up here. Oh no, I guess, yeah, they put them in that hole. So they're up a ways, and I don't know if they go around inside you, but they take up space. They take up space in your chest cavity, And when you're thin build, like I am, I'm 5'8" and 130, there's no room for your lungs to expand when you breathe. So every breath I was trying to take, it hurt. I was breathing so shallow, and they had to keep me on oxygen because I know I'm going to say this wrong, but is it carbon dioxide that you breathe out? Is it carbon monoxide? Whatever you breathe out. Because I was breathing shallow, I wasn't breathing it out and it was staying in me. So that level of that thing was dangerous inside my body, so they had to keep me on oxygen. Um, so anyway, then they have this incentive spirometer that I don't have with me right now, but you have to try to breathe in and, to expand your lungs and out. And I'll get into this in another video, but I found out the nurse that taught me how to use it was teaching me wrong. So I wasn't even using it correctly the first 3 days. I wasn't using this thing correctly. And I told the nurse that showed me the correct way, I said, you better show all her patients because this is what she taught me to do. And I'm sure all her patients are doing the same thing. So I'm doing this breathing thing. And one of my breaths in, I felt one of my tubes move. And all of a sudden, I think it was against my heart. So every pulse with my heart, it was grinding on this tube. Every single beat. And it hurt and it felt wrong. So I called my nurse. I'm like, something's wrong. My heart's beating and it's just that the tube, it's not smooth. It's like ribbed, like like jagged ribbed tube, like if you think of a bendy straw that you stretch out, those ridges, that's what these tubes are like. Um, so she listened, and she was gonna have the nurse manager come in and listen, or a doctor or something. And she said, you know what? We're about to take 2 of these tubes out anyway. Let's just get them out. So then they took the 2 tubes out, and I knew from reading other people's watching videos and reading forums that a lot of people said this is the worst part. When they pull it out, it's not so much pain, but it's very uncomfortable. And I've seen videos of people getting them pulled out, and these people just looked like they were in shock at the feeling because you never felt nothing like this before. It reminded me, and my sister, I just discussed it with her, and she said the same thing. And I'm not saying this to scare you. I'm saying it so you know what to expect. It wasn't painful, but it felt like a tearing sensation, almost like if you were skinning an animal as they pulled it out. She had me take 3 breaths, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, and on the 3rd time, breathe out, hold it out, hold it. And we practiced. She's like, we're going to practice. We can do this 2 or 3 times if you want. And then when you're ready, we'll do the real 3 times. So it was good that I knew when to expect it, because when the last tube came out, the doctor just pulled it out. No mercy, pulled the Band-Aid off quick. So anyway, I liked the way this nurse did it. And she explained to me the feeling. And she said it'll probably take 3 or 4 seconds. And like when she was pulling out, she's like, hold it, hold it, hold it. Hold it, hold it, hold it. And within 4 seconds, she's like, it's out, it's out, it's out. And then they had to apply pressure so air wouldn't get in, I guess. And it's a big hole. And so that hurt, that they had to hold a cloth to it for probably 2 or 3 minutes. So that wasn't comfortable. But the relief, let me tell you, you're going to look forward to the time that they're going to take these tubes out. You're going to look forward to it and expect it. And yeah, it's uncomfortable, but the relief afterward, like, oh my God, it doesn't hurt to breathe anymore. And my body's getting enough oxygen. And because I was worried when the tubes were in me and I was breathing shallowly with pain, I honestly, I honestly felt the pain I was in. I was thinking, I can see why people would want to die instead of living in pain. I was thinking before my surgery, I wasn't in this much pain. Why did I do this? You know, I had to. I would have had a heart attack. I had to do it. If I wanted to live, I had to do it. But that second day with that pain, and you know what? The surgeon told me the second day is the worst. Because I guess the first day you're drugged up. Um, and I was just thinking I shouldn't have done this because I didn't know if it was the tubes causing the pain, or is it really possible for me to feel better, or is this how I'm going to feel for the rest of my life? I was just really questioning my decision to have the surgery. So when they pulled the tubes out, I didn't have that feeling of my heart beating and pushing against the tube anymore. I'm just looking at my phone where my notes are. I got washed and put in the chair. That was nice because I was worried that I was going to get the sponge bath and it was going to be cold and it was going to be awful and uncomfortable. But they used these like kind of like adult sized baby wipes, and they were heated and warm, and it just felt good to have someone rubbing all your body, because I guess because you're sore all over, and it was just like a relaxing massage almost, you know? And then she helped me over to the chair, um, and it just felt good to be clean. Uh, okay, so I'm gonna make a video for day 3. So I'm gonna stop this one and make the next video for day 3. If you want to see my full recovery, I'll be posting videos for the next 2 years about what's going on with this. So click down there at subscribe. And if you have any questions, and it doesn't hurt so bad to cough. And while I'm while I'm thinking of it, that heart pillow they give you to hug does nothing. It hurt to cough because the breathing tubes. The incision honestly didn't cause me pain. It was the tubes on my chest. So when I coughed, the pillow, it hurt when I coughed while the tubes were in. And the pillow did nothing. It hurt whether I was holding the pillow or not. It felt equally the same. So I think the pillow thing is just a comfort thing, or maybe it will help some people. You know, I don't know. I just brought that up because I'm coughing right now. I've been having, since I got home from the hospital, right here hurts almost like a pulled muscle. I don't know if I fluid there or what, but it just doesn't feel good right there. It feels almost like I have a bruise that someone's pushing on. Okay, so I'm gonna stop recording and make the day 3 video.